at the end of the session. So without wasting any more time, let's just jump onto our 30 seconds countdown time.
Good evening, everybody. Good
Good
evening,
evening.
sir.
Very good evening to all of you.
We are back after a gap of 2 weeks again, and tonight we'll be hosting 92nd online CME live. And to go on with the show, with permission of our beloved President, Dr. Devnarayan Kalyani, sir, may I request tonight's inaugurator, a very brilliant student from 26th batch of BHMS, now doing MD at D&A Homoeopathic Medical College and Hospital, Dr. Arijit Sen.
Please go ahead.
Sir, with your permission, over to Dr.
Sure, sure.
Sen.
Please go ahead.
Good evening to all members of NIH Alumni Association. And today I feel it is my honor to inaugurate the CME program of our esteemed association. As alumni of NIH, we share a profound commitment to improve our knowledge to serve better. Today, this is our 92nd CME meet. Our topic is Scope of Homeopathic Treatment in Cervical Cancer. It's a burning topic in today's world. With a prayer, we shall begin our session. So we'll pray. तमसो माँ ज्योतिर्गमय मृत्युर्मा अमृतगमय शांति शांति शांति. From darkness lead me to light, from mortality lead me to immortality. Peace, peace, peace. We have our highly learned speaker, Dr. Lakshmi Gandhi ma'am, former Registrar, West Bengal Council of Homeopathy, to enlighten us about this topic. We have as our moderator Professor Dr. Ompriya Mishra ma'am, Professor and HOD Department of Gynae Ops, NIH Kolkata. I will request ma'am to conduct the session here on, and I will request Lakshmi Gandhi ma'am to enlighten us with the topic.
Thank you, Dr. Arijit. It's a great pleasure here, actually, to be after a long gap. Though I am watching all the CMEs, but yes, I am joining it after a long time. And without any more wastage of time, I am requesting today's speaker to please start with her presentation so that we all are eager to learn so many things. Ma'am,
Thank you.
please start your presentation.
Thank you. Thank you. Good evening, my colleagues, doctors, and the viewers. Today, our subject is the cervical cancer. Now, it is the burning question in front of us. As because we know all over the world, 660,000 cases are diagnosed every year globally. And among them, 350,000 died globally. The women are, rather we can say it is sacrifice themselves because they are not aware about these burning questions of the who. That is why today we select this subject, especially because it is of the very, very, very burning question in front of us. Okay, now the cervical cancer. We know the cervix is the parts of uterus, and at least the lowermost part of the uterus. So the cervical cancer, in among all the cancers, it is the fourth most common cancer in among the women's. So, Orgo, can you share the screen? Orgo, yes. Let me take 1 minute. Yes. Um, it is the fourth most common cancer among the women's. It is a malignant cancer at the lower part of the uterus, that is the cervical region, cervix. As we know, the cervix has two parts. Her upper layer is the squamous cell epithelium, and the inner layers containing the glandular columnar cells. So, in between these two, a transformational zone is there. The human papilloma virus transported through the intercourse from the male to the female via vagina, it will take shelter on that area. If the immunity is low of that woman's, and she is not aware how to get rid of from this problem, then she will be the sufferer. As we know, modern medicine can tell the after vaccination we can prevent this disease. The HPV vaccine, if inoculated during the children nine after 9 years of age, it can be prevented but not cured. And when the symptoms appear, if the woman are aware about this, and if she will go for the treatment to the doctors, then after pap smear screening test, she will be cured. So among our in our India, 3.4 lakhs cases are suffering from the disease as per the record of the 2023, and among them death are the 7.38 per 1 lakhs in India, as the report of 2019. The incidence rate in our India 18.3%. So, in this transitional zone, that is the ectocervix and between the ectocervix and endocervix, that is the squamo-columnar junction, this is known as transformational zone. The dysplasia, the malignant cell from the normal cell, is originated here. So, when the dysplasia start at the initial stage, if along with the symptoms the patient came to the doctor, and whether if she has the good immunity, she was aware about this, then after treatment she can get rid of from this cancer. Now we came to the anatomy and a little bit of pathophysiology about this. These when the about we know the squamous cell epithelium is the outer covering of the cervix, and it is generated at the in between squamous cell and the adeno columnar cell. So it has three types. We can get mainly 90% we get the squamous cell epithelium carcinoma. That is the carcinoma cell are present within the ectocervix region, and a very and second time of course the adenocarcinoma or the endocervical region. Very rarely we'll get the mixed type of adenosquamous carcinoma or mesonephroma. It is also called mesonephroma, but it is very rare. Now, what is the cause? That, as we know, the cause is the human papilloma virus. It has 40 variety of papilloma we can get. Among these 40 variety or stain, only the 13 are the oncogenic. Others are only creating the warts-like sign symptoms. Among these 13 type of causing human papilloma virus, 90% of them are causing anal and cervical carcinoma. 70% of them are causing the vaginal and vulvar carcinoma. 60% are causing the skin cancer near the penile part in case of male, and 60 to 70% are the oropharyngeal carcinoma. Of course, in case of oropharyngeal, the victim is also inhabitant with the alcohol and tobacco smoker. So we can think about the some risk factor is also there. We should know about the risk factor. As we know, before 20 years of age, the girls or boys are not going to the sexual life or the not married like that. So early marriage leads to this carcinoma, early sexual activity, having multiple sex partner, alcohol, smoking, multi-pregnancy, long-term use of oral contraceptive, and occasionally few pregnant women are taking one drug as per the prescription of the doctors, DES, that is the diethyl stilbestrol, to prevent the miscarriage. That will also lead to the fetus in future, the cervical carcinoma. And the low economic socio low economic status, if and social stigma, if any present, if it is present. So we should aware about this risk factor also. Now, if the patient is suffering from this starting the time it is start the carcinoma is starting at that time, we'll get some sign symptoms, bleeding between the two periods, and even after the menopause also bleeding per vagina, longer heavier menstruation bleeding, bleeding PV after intercourse, debauching, even after pelvic examination in case of any gynecological problem, profuse vaginal discharge with strong odor and blood, pain during intercourse, bleeding after menopause, unexplained persistent pelvic and back pain. Patient is worried about it, taking so many medicine, but pain. I am also feeling pain on the back and on and the lower parts of the abdomen. So when patient come with this type of sign and symptoms, we should send her for the pap smear screen test. This is the only test from which we can understand that dysplasia at the transformational zone of the cervix are starting. That is the normal cell converted into the malignant cell. If we'll get dysplasia, then after that we have to advise for the colposcopy, that is the examination of the cervix, and for the biopsy. But we should think about the what type of uh, case now, in which type of cases which this patient is belongs to, that is the squamous cell carcinoma or adenocarcinoma. So after diagnosis we will get the different stage when it has the four stages. The carcinoma has the four stages. First stage, when the malignant cell is confined, totally confined within the cervix and not spreading beyond the cervix. This is the main type 1 of carcinoma, cervical carcinoma. If in this stage patient has come, in case of modern medicine, they have surgery or chemotherapy like treatment, and after that the prognosis is very highly curative. Patient can get rid of from her cancer cell. But if the patient ignore or not aware about this fertile this type of cancer, prognosis of the cancer, it will again in the progress of the cancer cell, and it will convert it into the second stage, where the cancer cell spread into the lymph glands, even a little bit of vagina. So this is called the second type of carcinoma, cervical carcinoma, second stage of the cervical carcinoma. And the third time, when the cancer cells spread beyond the cervix, vagina, and pelvic region, and the uterus also. This is also very grievous condition. And the last, that is the fourth, when the cervical cancer cell spreading from the leaving the uterus and spreading all over the body, such as the bones or liver, kidney, lungs, in etc. In case of, if we take 5 years for the survival in case of cervical case, so in first stage, when it is diagnosed and treatment was started, 91% patient can survive 5 years. 91%. But in case of second and third, only 60% patient can survive 5 years. In case of fourth stage, patient only survive 5 years, only 19% cases. So awareness in this case, in this disease, very, very important for us. So we should aware about this. uh, Awareness must be, we should think about this awareness. Now awareness, as I told, that early marriage means early sexual life, leading their early sexual life. So more the exposure, chances is more for the cervical cancer. So no early marriage and no early sex life. Avoid the smoking and alcohol, removal of the social stigma, if any. Spread the awareness throughout the newspaper, TV news, local NGOs, and for the walking. By any means, we should aware the society omens about this cervical cancer. If the patient has some upper respiratory tract infection regularly, then he should go for the doctors for the checkup. As because I told that 30 strain of the HPV, that is human papilloma virus, are causing this cancer. Among these 13, I told you that 60 to 70% are responsible for the oropharyngeal cancer. So it may be the upper tract respiratory carcinoma due to this HPV virus. So they should go for the doctors for examination. If gynecological sign symptoms appear, then routine papillomavirus test must be done, or that is the pap smear test. In case, as we know, the before 20 years, nobody generally there is no any sexual life. So after 20, that is 21 to 29 years, uh, once in a once in every 3 years should be pap test done. She should done a pap test. And 30 to 65 years, once in every 5 years. So if the patient is aware about this, then only we can keep them healthy, or patient can be in cure, on the way of cure. As per the modern medicine, we can get the prevention, we can get rid of, we can be prevented this HPV virus and the cervical cancer by inoculation of the vaccination, HPV vaccine. And this vaccine is from the 9 years of age in case of girls and 11 years of age in case of boys. But it does not mean that those who are getting receiving the vaccine, they will be not affected by cervical cancer. They are not giving the guarantee. And secondary prevention by the pap smear test. If it is positive, then as per the modern science, it can go surgery, chemotherapy, or fridge, or laser. So many treatment processes are there. Tracheo, trachelectomy, and conization, laser, different type of, many different type are there. But if in case of our homeopathy, we are not going about this, we should think about the, depend upon the totality of symptoms, and we'll get totality of symptoms, and so many medicine, they are helping in our pathy. So you can see in my slide that so many medicines are there, but we should depend upon the totality of the symptoms and the miasmatic background, also the susceptibility of the patient. Generally the patient, when suffering is continuing, the susceptibility was high and the immunity become low, and that is why we should think about our potency selection and the repetition selection. We should give importance in this case. So mm, one thing is there, you know very well about our medicines, how to, when and how it will give. But few medicine are very much effective in this case, such as in our in my slide you can see the fuligo. This Fuligo medicine is very helpful in case of oropharyngeal carcinoma due to this human papilloma, especially at the tongue and buccal mucous membrane. In case of, as because patient is suffering morose, sadness is there, and always thought about the suicide. So many medicine are there, but when, as because this is not fully proven medicine, but when will you get, at that time we have to also think about the palliation of the treatment, because at that time if we will give the polycrest and medicine and antimiasmatic, patient may be worse, and medicinal aggravation may be occur. So we should think about this potency. And there is another medicine also, Xeranium maculatum. Xeranium maculatum is very nice medicine for this cervical cancer also. When the cervical cancer cell spread outside the uterus pelvic cavity and attack to the bladder, urinary bladder. So with urine, blood is also coming, and ulceration at the mucous membrane of the bladder. So at that time, along with the map tongue, yellowish skin like jaundice, and hysterical mentality, we can think about the xeranium, and also taraxacum. The taraxacum is a very nice medicine. I told you about this matter. Fuligo and xeranium. Xeranium is one of the best medicine when the cancer cell spread into the gastric GI system, that is on the stomach or large intestine or in small intestine. At that time, we can think about the xeranium. And when this anal carcinoma occur due to this HPV, so at that time, ruta, hydroxysteroid, kali cyanide, so many medicine are there as per the totality of the symptoms. As my advice, we should think about the 50 millisimal and in fractional dose, and starting from the 0 by 1, whatever medicine we will select as per the totality of symptoms, miasmatic background. And the and we should also think about the, occasionally we should give importance to the clinical symptoms also. So we have so much scope, as because in case of carcinoma in general, carcinoma, the modern medicine has only the amputation if possible, otherwise radiotherapy, chemotherapy, radiation, like that. So in this case, so many bad effect and side effect are found, we will get in the patient, such as the falling of the hair, weakness, and skin become loose and lax, and looking like a old woman like that. So in case, so at that time we have no any side effects. So if we'll get in case of a cancer case, we will treat our medicine, and that will be, I didn't tell you that it will cure the cancer, or again the malignant cell become the normal, but it will relieve the trouble of the patient, and patient feel better, as because we know the carcinoma, if untreated, patient was unaware and lying, it is dead. So the fatal is the result. We can give her a painless and troublesome life. We can give her a peaceful life, rather we can say. She knows that she will die due to this cancer, but her complaint become, we can ameliorates, rather we can say ameliorates. So a little bit I can see, tell you about the vaccination, because nowadays government are very much speaking about the vaccination. Several companies are there. Among these, Gada Rasil vaccine 9, it is very much popular in time, in this time, and government is also encouraging us to give the child, girl and boys, this vaccine. Only 2 doses, that is at the 9th years of age in case of female, and 11 years of age in case of boys, and after 6 to 12 month, second dose. But if started after, it can be started any time of the life form, even in 26th year we can start it. It is the modern medicinal therapy, and for the prevention of the cervical cancer. But we have so many good and best medicine to treat our cervical cancer as per the totality of the symptoms. So we are very much faithful about our medicine, and we can ameliorate the complaint. I didn't tell confirmly that we can cure the cancer, but we are trying to relieve the troubles of the patient. Okay, thank you. Any question anywhere? Sir, Kalyani sir.
Among us regarding this.
Thank you, sir. So much time I took.
No, no,
more
no,
than
no,
30,
no.
more than 30 minutes, so we have
Most,
to.
most important things we have focused. Officer Ompriya Mishra is not available now.
Yeah,
What's that?
Ompriya ma'am is there.
Yeah.
Okay, okay.
Over
Yes,
to you,
she,
Ompriya ma'am.
Hello.
she is
Am I
there.
audible?
Yes,
You are
yes.
audible,
Okay.
clear.
Oh, okay, sir. So it's a really very learning experience for all of us. That regarding cervical cancer, we learned so many things from ma'am regarding the starting from the etiology, the pathogenesis, and everything, the signs and symptoms, the manifestations, and how to prevent and how to proceed. So this is really a very nice experience today that I came across with this cervical cancer. So I would like to thank ma'am for her nice presentation and a very complete and detailed presentation on this topic. I hope our viewers they have learned so many things from this because this is really a burning topic, and nowadays what ma'am told, in India this is one of the leading cause of cancer in women. And clinically, if I'll tell, out of my small clinical experience in NIH, regarding the cases of cervical cancer. One case that I got some few years before, that lady actually she was diagnosed with cervical cancer, and she went to Chittaranjan hospital. She underwent the radical hysterectomy followed by radiotherapy. Doctors advised her to move for 3 cycles, but after taking only 1 cycle, she was completely bedridden, and there was extreme of vomiting and burning of the whole body. She was not able to take anything, so she was completely bedridden situation. So her family members they took her, bring her to NIH in a stretcher, and at that time Dr. Yashidas sir he used to be there, our most respected gynecology teacher. He was there as a guest professor. So sir told that definitely we cannot help in any way. What to do? So she has to continue the radiotherapy because there is no other alternative. Some. So, but ultimately patient was not able to take, and I told her let me try just to combat the situation. And after taking the whole thing, I started the treatment with phosphorus. Because she was, it was a very simple prescription for a homeopath. She was very tall, and one thing was she was craving for the coldest thing. She was a poor fellow actually, a daily laborer, but she craved for the deep freeze ice water only, and a great fear of thunderstorms she had. So with this only I started with phosphorus, and in 50 millismol, and with very few doses, all her complaints that she was suffering from the bad effects of radiotherapy that has gone, and she ultimately improved as a whole, and she has continued with phosphorus a lot, and after few years something, I started with arsenic, again basing on the signs and symptoms. So what our oncologist, Dr. Sanjay Das sir, he advised that every 6 months she had to have the follow-up of repetition of USG and the blood analysis. Okay, ESR and all these things. So as per that advice, I used to repeat also, and she was much better. There was no recurrence of the things with homeopathy, with this medicine. Her bad effects has gone, and there is no chance of recurrence. So this was one case, and another case very recently that I get. In between there are so many other cases, but recently that one case that I get, which I would like to share, that in case of cervical cancer, as ma'am already told, that early diagnosis is always a blessing for the patient and the family member. So early will be the diagnosis. There is will be much better chance to recover and for a long survival of the patient with a leading a healthy life. So one patient that I get just during this Durga Puja, she is a lady of only 27-year-old, and she came with profuse bleeding for vagina uncontrolled for few months. She had taken all sorts of medications, allopathy and everything, and a pause she had taken something in like anything she had taken the pause 500, but nothing. There was of no use. So she came to our OPD. It was a complete painless bleeding, a bright red profuse bleeding, painless. No other symptom was found. Only basing on this painless hemorrhage, I prescribed millifolium, but that just reduce a bit for few days. Again she had the bleeding, and this type every time she used to have a bleeding, some medicine will come, I'll prescribe, she'll have the control for few days, again she will have the bleeding in profuse. So I examined because it was not possible to examine the case because bleeding was continuing. So I advised to move for a USC, but patient was reluctant to do that, and with she was very ready to continue with the homeopathy medicine. But it should always be keep in our mind that because patient is ready to do, we should not be very happy. we should always move for the clinical examination. If that is not being possible because of the condition, we should move for the investigations. So the many times I advise, they were not able to do, and they are not actually interested to do. They are telling, no, ma'am, whenever you are giving the medicine, I am fine. So let us continue. You please give us the medicine. So anyway, after giving this creosote, ultimately the bleeding was controlled, and I told, no, you come and I'll examine once the bleeding is controlled. So after examining the case, what I found that yes, there was so much of offensive discharge from the vagina that we all the myself and the interns, PGTs, it was a very horrible experience for all of us to stay in that room. And on examination, what I found, the whole area is just gluted and very hard. The cervix on slightest touch, it started again bleeding. So immediately I advised to move for the biopsy. And they this time they are sincere and they did it. And very unfortunate to tell that she was being diagnosed with stage 2B cervical cancer. Okay. So invasive squamous cell carcinoma. So this is very unfortunate that because either patient is reluctant or many times doctors are also reluctant. They are not doing the examination and giving the medicines. One case, yes, that I would like to share in our OPD. Patient came back from other OPD and she was treated for years together for the white discharge of vagina. One of our seniors, he was treating, and after few years, accidentally the case, I got the case, and I examined the case. What I found that yes, she was being treated for years together for cervical cancer. This is a case cervical cancer. So not actually diagnosed. I suspect the case. By clinical examination, I immediately sent for examination and for the biopsy, and it was a confirmed case of cervical cancer. So each and every case, it's my request to all of you, whoever you are listening, that each and every case of white discharge for vagina or unnatural bleeding or postcoital bleeding, whenever it is there, we should first move for the at least clinical examination. If we are in such a situation that we are not being able to do, say for example, there are the male doctors, they are not being able to do this examination in their clinic, so you should refer it to a gynecologist. If not, then advise the patient for a TVS. TVS, if you are doing, no, so that will be much more, that will give you a much more better picture of the cervix and the whole pelvic region than the USC of the lower abdomen. So this will have a very proximal picture because every patient cannot move directly to the CT or MRI. Everybody also cannot afford. So TVS should be avoided in each and every case of any abnormal discharge. Either it may be bleeding or white discharge. So whatever it may be, or any postmenopausal bleeding, postcoital bleeding, that all should be advised for a TVS immediately without any loss of time. And TVS will many a time give you a proximal, the very initial diagnosis. And if possible, definitely do a clinical examination so that you can diagnose the case very early, because early diagnosis is the blessing for the patient and all. And regarding the homeopathy treatment, ma'am has already given a long list of medicine which are really helpful. So already she has described also a few medicines. So without any further lingering, my talk, I would like to request. I would like to request our most respected and most experienced teacher over here, Dr. Kalyani sir, to please share his experience on this topic. Sir, please.
Thank you, Ompriya. Very thanks for nice moderation. And we are really thankful. And of course, we are very much benefited by the brilliant speech of our excellent speaker, Madam Gandhi. We have learned many things. And the one thing what he has focused several times, that is the only way out to get rid of the serious disease, fatal disease. That is awareness, awareness, and awareness among our family members, among all our patients, among anybody who is concerned with this. We should ask the patient to be aware and intermittent checking. Anyway, we have learned many things from Madam's presentation. A little thing I want to share as per my experience is concerned. When I was a teacher of Bidyut Homeopathic Medical College, right here, we had one homeopathic doctor. He was departmental head of surgery during those years, which I am talking about of 1981-82. So he used to do surgery of his own with the help of ordinary homeopathic doctor. Not even a single allopathy doctor was present there during that time. They were not easily available. Appendicitis, then your hydrocele, then your almost all operations of the extremities, even this appendix, hydrocele, etc. He used to operate of his own. He told one day in my teacher's room, that Dr. Colin, I heard one thing, I went there, I have seen that one quack homeopathic doctor, he is giving echinacea mother to a number of patients who are waiting in a queue. Everybody is coming, he is giving some placebo and echinacea mother. So obviously there is some improvement. Otherwise, how so many patients are waiting for him in a queue? Then quack. I heard it. I just ignored that this might happen to any quack. As we have seen, many people get rid of their suffering or certain companies by wearing madhuris, tamijes, this and that, water, etc. I simply ignored. But when I studied the literature, available literature regarding echinacea, I was astonished. That is a serious drug that I kept in my mind, but I didn't apply because I didn't got so many number of patients. This is about the echinacea. I will tell you later on. Then when I joined in NIH, I found accidentally one case was brought to me on a stretcher and reported that this mother has been refused from the operation theater. She had complete open abdomen surgery for pain and rapid loss of body weight. Investigation and the operation reports are there is severe matting between gallbladder, peritoneum, stomach, and liver coverings due to cancer carcinoma of gallbladder with a stone, not a stone, with few stones in gallbladder. So it was diagnosed that gallbladder carcinoma metastasis to adjacent tissue. And they have refused because operation is not possible. Matting is so much that there is no chance of recovery. Abdomen was closed, patient was refused from a renowned hospital. They declared that give her any diet, so long he will survive. Soon he is going to die. There are severe ascites and all other common symptoms of the carcinoma of abdomen, piles, bleeding, etc. What I learned in our Calcutta Homeopathic Medical College teacher, Dr. P.C. Pal, Dr. S.K. Dubey, Dr. Manju Singh, etc., that if you treat a patient feeling that you are treating a cancer or an abscess or a gastric ulcer or a diagnosis, if you treat the diagnosis of the patient, you are lost. Your patient is also lost. You will not get success. But you treat the patient, ignoring the disease. That patient is sick, he might suffer from multiple diseases, starting from cancer to whatnot. Then chance of recovery and your success will be definitely more and more and more. That stuck to my mind. Homeopathy is the easiest system of treatment. What I consider by learning this, that simply consider the person. If anybody forgets about the disease, still there will be improvement. Sometimes there will be miraculous cure as it is done by the quacks in our villages. And you will agree with me that today's flourishment of homeopathy in all over India and abroad has started from these quack doctors on homeopathy, the RMP doctors. Their successes gradually inspired the people to learn homeopathy, to treat homeopathy, and to improve the surgery system of medicine simply because they were ignored about the diagnosis. They were ignored about the histocytologies. They are ignored about the investigations. They were ignored about the prophylaxis measures. Simply they were concerned with the symptom totality by reading some Bengali books, are very common books, Parivarik Sikis, etc. Their concentration was only on the person is suffering for getting the disease. That stuck to my mind. Such a disease system of treatment, homeopathy. So I decided that whatever they are doing, patient will die. Family members has been confirmed. So I simply consider that is a very short period, a huge, tremendous body weight mother reduced to a skeleton with only abdomen, as it is abdomen is the only body, big abdomen with ascites and always on bed, not able to get up and sit on the bed. I consider syncona, all of you will consider that rapid and severe loss of body weight is syncona. At that time, LM potential was not available. I learned that serious pathological disease should be started very lower potency. I started giving Syncona 6, telling the patient that I may not be able to do something, but so long he survives, as we have been aware of that patient is going to die, let us try. Patient party told, we know he will die. You do what he would like. You have many teachers, consult them, as per you can do, please help us. If my mother lives for a few more days, you'll be astonished to know by giving Syncona 6 within few days, patients started eating. Discomfort coming down gradually. Pedal edema started reducing. I am taking out 1 to 3 months duration. So this 6 potential started improving. Then improvement stopped. As we learned, I tried with 30. Again, improvement started, progressive, abdomen is reducing. And what I have asked, when patients started improving, started eating something, and swelling of the abdomen is reducing, I asked the patient, you should have ultrasonography in every alternate month. And I want the reports to be confirmed what changes are going there. Ultrasonography report came, it was found that stone has been reduced in size. Thickening matters are there, ultrasonic shadows are there. Asked them to scan, they could not afford to take scans because they have been already wasted by end of treatment in private hospital. By ultrasonography repeatedly, every alternate month, I found gradually, ascitic fluid is coming down, stones are reducing, matting is still there. Spatting is eating, pedal edema has reduced, and patient is becoming thinner, means body weight limbs up as before, abdomen is reducing, patient is looking like very sick. I was encouraged, I continued, then again 30, potency stopped giving improvement, further improvement, I gave 200. By this way, I went up to 10 gradually. By 3 years, you won't be able to believe. I have the document. If I get the chance, I will show you. Probably I have shown it in 36 CME when I presented the lithiasis presentation by 37 cases of gallbladder stone. The first inspiration of gallbladder stone curing was my that patient. Cancer of gallbladder, stone reduced and reports become normal. Then I sent to a sergeant, oncosurgeon. By seeing scan, he did scan. He reported that there is no matting, gallbladder is free, liver and other adjacent tissues are normal. That patient lived another 18 years. After heart treatment, he gained weight, became average normal weight, not that much of heavy weight before. After about 8 years, her husband started suffering from oral carcinoma. Unfortunately, they could not depend on me, whatever may be the reason. They went to the modern medicine system, started treatment, and he died within 3 years of starting of the treatment. But after death of her husband, he lived another 5 to 6 years, means complete normal life. He died at the age of 93 with other complaints, senile complaints, not of gallbladder, not of carcinoma. That was tremendous experience in my part. Then what, while I was serving in NIH, in the research department, we had one research project on cancer. And Dr. Das Madam Ompriya, that's what Ompriya Mishra was telling. His name was, just he has mentioned, Sanjay Das. Dr. Sanjay Das was oncologist. He was always with us. He used to guide regularly all the cancer patients. Every patient will come before us, Dr. P.K. Mishra, with three doctors of RA, research assistant, and
Mm.
Dr. Sanjay. All together we used to see the cases, and all together we used to decide what to do. In case of serious condition, fatality, Dr. Sanjay Das used to support by giving necessary measures for modern medicine, and rest treatment, basic treatment will be homeopathy under the guidance of Dr. Sanjay Das. Those who are in that seminar, they will know. Those who are not in the seminar, just believe me, that one seminar on cancer in our seminar hall, in presence of PGT and UGs and interns, Dr. Sanjay Das was the speaker, and our fellow members were speaker. He himself is telling that I have seen homeopathic medicine can prevent metastasis. This very language. Homeopathy medicine can reduce drug hazards, iotic effects of chemotherapy. Homeopathy medicines, in spite of having cancer, can give some improvement to the general life. And obviously, homeopathic medicine can prevent the first progress of the disease. That was his declaration by saying joint treatment by homeopathy and allopathy, not our decision, that is the decision of an oncologist, renowned oncologist. So what I want to tell you, brothers and sisters, that don't get discouraged by seeing or hearing it is cancer. Be encouraged. The patient is suffering from, pulsatient is suffering from cancer. CP is suffering from cancer. Catheter is suffering from cancer. If you consider it this way, you will get a miraculous improvement. Our plan of treatment was we should take cases in a definite format. We should select a drug jointly. Then we used to ask sponsors of what immediately should be done. He used to give us clearance that continue homeopathy medicine. I will tell you when it is necessary to manage the cases. We used to give consultation medicine first. We used to wait and wait and wait. If at all necessary, some short drugs are given to improve the cases faster, to bring confidence of the patient. Those few drugs have been already mentioned by Madam Gandhi. And still, I want to tell you few drugs. That is calicyanate, mark cyanate, potassium cyanide. You know, it's a serious disease. But we have experienced in NHOPD on the number of cases that is cyanide groups of drugs, combined drugs, are very much effective in carcinoma diseases when they are becoming angry and aggressive during the course of treatment. So anyway, along with this, I tried echinacea in several cases. Nowadays, at this stage, I am so much confident that I never refuse a single case. Simply, I confirm the diagnosis by investigation reports. Then ask the patient, you have to wait and observe. Along with me, if you find you have been stable, homeopathy is working. If you find improving, homeopathy is working. If there is aggravation, then you can decide of your own. I will tell you what to do. I will refer you to oncologist or modern system of medicine. In this way, bring the confidence that I will guide you what to do. You just go seeing the observation. Obviously, like other serious disease treatment, first observations will be general improvement. That is appetite, sleep, and other things will start improving. Just a minute, sorry. Other complaints, appetite, sleep, these things will start improving first. Those indications that patient is eating better than before, patient is sleeping better than before, patient is feeling fresh better than, it is obvious that your medicine has started working. Whatever slow speed it is, please wait and wait and wait until the case demands other medicine. I have seen number of cases, including lung cancer, I am telling. Patient is getting relief to such an extent, he is maintaining a normal life. He used to withdraw the chemotherapy. I have seen cases, patient is able to withdraw chemotherapy and could avoid surgery by homeopathic medicine. But because it doesn't get number of cases to show you the cures of cancer, we won't be able to tell you at this moment. But improvement we have observed, many of my alumni have observed. Oncologist has seen, observed, and expressed his view that homeopathy has great effect on homeopathic medicine by homeopathic medicine. So all of you, I request all of you to get confidence regarding any disease, especially cervical carcinoma, along with the prevention and follow-up and awareness. We should be confident that we'll start treatment, confessing that I will try bold seeing the improvements. Patient will say, improvement of the patient will say what to do now. So anyway, many thanks to Madam Gandhi for giving brilliant presentation on a very serious disease. Not only the case is fatal, but the whole family becomes fatal. If a mother is fatal, means whole family is lost. This is a serious disease. Once we are treating a mother, means we are treating a whole family of
Yes, sir.
number of children, husband, etc. So it is a great work. Thank you very much.
Thank you.
Thank you so much, sir. And Lakshmi Di, we are really proud to have alumnus with so rich, vast experience of NIH. We'll like to request all the alumni who are watching this live session or will be watching in the future, please come forward to be a speaker and to share your experience through this CME program. And with this, with permission of Kalyani sir, we don't see any question on the live chat till now.
Hmm.
Okay, there are no questions in the live chat. We are within 1 hour of stipulated time of the CME. And with permission of Kalyani sir and Lakshmi Di, we are returning back to our backstage editor or Mukherjee.
Okay. Thank you. Good
Thank you
night,
very
sir.
much. Thank you to all on screen and out of stage. Good night. Many,
Good
many
night.
thanks. Please come again.